My name is Judy Collette Miller. I'm the Director of Business Development on the strategy team at Parker Healthcare Group Incorporated, which is located in New Jersey. Parker Healthcare Group is a aging services organization, and we offer long-term care, post-acute, assisted living, memory care, and home and community-based services for older adults. So we serve residents here in our communities in New Jersey, so residential facilities or residential homes. And then we also offer services to older adults out in the community. And along with that, we have partnerships and collaborations with local community organizations and our local university, Rutgers University, as well. The original problem is we were looking to develop a new product at one of our homes. Sometimes it felt like when we tried to start a new project, it took an awful lot of time to get from point A to point B. And so the lean was introduced to us, and then we decided to use it. I don't think we realized what we were looking for, but lean ended up being, for us on the strategy team in particular, a framework to help us move our projects forward in a quicker manner. And lean really gave us kind of a structured way to think about our audiences, think about our stakeholders, think about the problem and what we thought we were trying to solve. And then when we started using lean, oftentimes we realized that maybe we didn't know the problem, or the problem we were thinking about was different than the problem maybe our stakeholders had. What we basically were saying is we had clients who were with us in our residential unit for a short time, and then they were going home. And what we heard from our staff and what we thought we heard from these clients were that they needed help when they got home. And after going through lean, what we did is we had a lot of discovery calls with people, and just said the open-ended statement, which we learned so much about, is rather than presenting a solution to a problem we assumed was there, we then started having conversations and said, okay, now that you're home, what does your day look like? Are you facing challenges? What could be different from you? And so in asking those types of questions, we learned a lot of different things back from our clients. We were really surprised. At the end of this project, we ended up parking it because we realized the need we thought was there was not. Well, I think the biggest challenge for all of us was believing the data. And what we found is, I think some of our biases are really good biases in wanting to help people, sometimes led us down a path that wasn't the right path. I think after that first project, and we probably took a little more time than maybe others have with lean, is I think we felt very confident in the way the lean methodology worked. We all felt very good about we made the right decision for the right reasons. And that's why we then took it on to another project, which we're in the middle of right now. And we did our initial lean discovery, and now we're going back and doing some more because the initial results gave us enough data to say, yes, go forward, try this minimal viable product, whatever that might be. And that's working well. And now we're going to the next iterations. One of our more recent projects is it's not even within healthcare, but I think nationally and on the news, everybody sees this, the challenges for caregivers. So caregivers of people of all kinds of ages, right? So people who need support at home, and oftentimes that's family members, loved ones. We use the lean methodology to kind of test our assumptions and to see if there's something we could do. So we did discovery work with this particular group of individuals. We did discovery calls with about 30 different individuals, and we spread them across our demographic region, across New Jersey, and did over about 30 days these calls and just spoke to people and said, what does your day look like with your loved one? What does support look like to you? What are challenges you faced? And then we just listened. We listened a lot and tried not to prompt too much. So this information and resources, through these questions, we thought that an online resource might be something that would support these caregivers of older adults at home. So we built, based on the lean work, we made a recommendation and got some funding, some very small funding. This wasn't a big ask, to develop a modified portal, kind of a website/portal for caregivers at home. So we had done some surveys, and we were finding positive results. So we're now in our second round of lean discovery to go back and say, okay, for this group, we know that this is working for you. Is there anything different? What does your life feel like now? Has this made any changes? And we're also now looking at different populations who might also be supported by this work. So we did initial discovery. We found a problem, a challenge. We defined a temporary or a modified solution, this kind of beta website. We're getting good results. We're now going to go into phase 2 with that and continue to test. And at the same time, we're doing additional discovery to see if this might be able to support other older adults at home as well. So we've used the lean process to define the problem, to validate the problem. We're offering a solution, but also validating the solution to make sure it's the right thing. So that's where we've used lean over the last year to kind of move this particular project forward. In lean, we hear about the minimal viable product. I think we overthought that it has to be something huge. It has to be something big. A minimum viable product can just be a small solution to an existing problem. This is a spot where I think we get stuck sometimes is we get mired down in, do we have enough data? Do we need to talk to more people? So that whole idea of going through lean, and maybe you don't talk to 100 people, but if you talk to 50 and they're all telling you the same thing, that you can say that you can take that as valid and move forward. Lean can help you in products and services, but I think for us, it's also helping us in looking at our processes and how we can improve some of our processes as well using that lean methodology. I hope I'm making better decisions, and I'm hoping when I bring recommendations forward to my boss or to our leadership team, I'm confident in what I'm bringing forward. And I think our discovery and talking to them about our stakeholders and how we've done this work makes a real difference and makes them very comfortable